Have you ever felt lightheaded, felt that hot rush, the world narrowed to a tunnel, and the next thing you're on the floor? That sudden faint is called a vasovagal syncope, and it's the most common cause of blackout. Today, I'll tell you exactly what's happening inside your body when you faint, how to spot the warning signs, and most importantly, how to stop it. If you're new here, I'm Hafiz, a cardiologist training in London. I started creating videos to increase awareness of heart disease so you can lead a healthier life. Don't forget to subscribe if you haven't already, so you'll be the first to watch my videos when they come out. Okay, let's get back to the video. Vasovagal syncope is the medical term for fainting caused by a sudden drop in heart rate and blood pressure, which temporarily reduces the blood flow to the brain. In most cases, it is harmless, particularly if it's occasional and there's a clear trigger. It can be dangerous if you fall and hit your head, if it happens without warning, or there is an underlying heart problem, but this is rare. Let's go through the physiology. Why does it happen? Vasovagal syncope is usually caused by a trigger. This can be a hot summer's day, standing for long periods, sudden pain, or emotion. In these situations, your body should normally tighten its blood vessels and increase your heart rate, but instead, the vagus nerve tells your body to relax. So you get blood vessels that dilate in your legs, your heart slows down, and your blood pressure suddenly drops. As a result, you faint because there is not enough blood flow to your brain. When you are on the floor, this restores blood to your brain, so you wake up usually in about 15 seconds. Common triggers in real life are things like standing for a long time in a crowded train, the sight of blood if you're not good with getting a blood test or with needles, sudden pain if you stub your toe, for example. Dehydration and a hot place are other common triggers. You'll usually have a warning sign, what we call a prodrome, before you faint. It's like your body telling you it's about to faint, so you have some time to act. Warning signs are things like feeling a warm flush, feeling nauseous, seeing spots in your vision, feeling sweaty, and that sinking feeling. If you've experienced a faint, you will know what I'm talking about. If you or someone who is with you gets these warning signs, this is what you should do. Firstly, lie down or sit down and put your head between your knees. If this is not possible, tense your legs and glutes. These increase blood flow to your brain and will make you feel better. Another tip is to slow down your breathing and take deep breaths. Sip water if available. This will also help raise your blood pressure and cool you down. If you're the helper, check responsiveness and breathing. Loosen tight clothes, keep them flat, and call emergency services if there is associated chest pain, seizure-like activity for more than 30 seconds, or no recovery within a minute after the faint, and any obvious injury. So when is it not a simple faint? The red flag symptoms are if it happens during exertion without warning. So if you faint during exercise, for example, that should be checked out. Family history of sudden death, particularly if it occurred less than 40 years of age. If there is known structural heart disease like hypertrophic cardiomyopathy, for example. I've done a whole video on hypertrophic cardiomyopathy, and I'll link to it somewhere on the screen. If there are symptoms such as palpitations or chest pain before the faint, if there are falls that cause injury without any of those warning signs, if any of those sound familiar, you need to get yourself checked out. When you see your doctor, they will do the following. They will ask you questions about what happens when you faint, and it's a good idea to have a trigger diary to see if you have any of those triggers that I spoke about. A careful history alone will make 90% of the diagnosis. They will then examine you and probably do a sitting and standing blood pressure. You will have an ECG to exclude rhythm problems, blood tests to look for things like anemia and electrolyte abnormalities. And in some cases, if the diagnosis is unclear, you may have a tilt table test or a Holter monitor, particularly if the episodes are atypical. The good news is that there are things you can do to prevent vasovagal syncope. Step 1 is to keep hydrated. Aim for 2 to 3 liters of water a day, and in hot weather, keep a water bottle to hand. You may want to consider a salty snack, particularly if you know you are taking a train and it's a hot day. Salt holds on to water, so helps keep your blood pressure steady. This is particularly true if your blood pressure tends to be on the low side. Next, know your triggers and try to avoid them. You can train your body with physical counter-pressure techniques. At the first warning signs of symptoms, squeeze your thighs and glutes or do a quick squat if it's safe. These moves squeeze your leg muscles, pushes blood back up and stops the faint before it wins. If you're prone to fainting, especially on standing, consider wearing compression stockings. This again helps prevent blood from pooling in your legs, keeping your circulation more balanced. In more severe cases, when lifestyle changes aren't enough, your doctor might consider medications like midrodine or fludrocortisone. These help raise blood pressure and reduce fainting episodes. And in very rare cases, cardiac pacing may be used, usually only in older adults with documented pauses in heart rhythm. But for most people, the right habits are all you need. So let's wrap this up with 3 simple tricks you can use anytime you feel faint coming on, especially in known trigger situations. Number 1, pre-event power-up. Before a triggering event, like a blood test, have a salty snack and drink 500 milliliters of water about 30 minutes beforehand. Think of it like prepping your blood pressure. Number 2, engage your muscles. The moment symptoms hit, clench your fists, tighten your calves, and engage your leg muscles. It might just stop the faint before it drops you. Number 3, get low before you go. If all else fails, lie down flat with your legs up. Get down before you drop. Fainting isn't always dangerous, but preventable with the right tactics. Click that like button if you learned something new. Share this with that friend who is prone to fainting. And tell me in the comments if you've ever had a vasovagal scare. Thanks for watching, and I'll see you in the next video.